Welcome to my presentation. This is Mazharul Islam with you, dear viewers. I am going to present before you about health news from English newspaper. Its headlines: updated vitamin D guidelines, what clinicians and patients need to know. Now I am going to in details. In 2024, the Endocrine Society issued updated guidelines on the evaluation, treatment, and prevention of vitamin D deficiency in adults, reflecting recent research. The new recommendations, which replace a 2011 guideline, aim to simplify the approach to vitamin D testing and supplementation. Key changes in vitamin D guidelines. Previously, the Endocrine Society defined vitamin D levels in terms of deficiency and insufficiency based on serum 25 hydroxyvitamin D 25 OHD levels. However, the new guidelines no longer categorize vitamin D status. In this way, research has not confirmed a clear connection between specific vitamin D levels and clinical outcomes, leading to this shift. For most adults aged 19 to 74, the guidelines advises against routine vitamin D testing or supplementation. Instead, it recommends following the U.S. National Academy of Medicine's daily intake guidelines 600 IU until age 70 and 800 IU daily for those over 70. Special recommendation for older adults and pregnant women, while routine testing is not advised for people aged 75 and older. Empirical vitamin D supplementation is recommended due to its potential to longer mortality, although the evidence is modest. Supplementation in older adults should focus on low daily doses, about 1000 IU, either through fortified foods or supplement. Pregnant women are also advised to take vitamin D either from fortified foods for supplements to ensure sufficient intake. Other key considerations. The guidelines also recommends vitamin D supplementation for adults with high risk pre-diabetics, as research suggests it may help lower the risk of progressing type 2 diabetes. However, there is no clear definition high risk pre-diabetics compared to regular pre-diabetics. In contrast, the guideline advises against routine testing for vitamin D levels in individuals with obesity or darker skin tones. No evidence support need for routine screening in these populations. Impact on clinical practice. The new guideline could significantly change how clinicians approach vitamin D testing and supplementation. The practice of routinely testing vitamin D levels, prescribing supplements to raise level to 30 ng/ml or higher is no longer recommended. However, these guidelines does not apply to people with conditions affecting vitamin D metabolism, such malabsorption, chronic kidney disease, or bone disorders like osteomalacia. For home testing and treatment may be necessary. Clinicians should also be aware that while diet and sunlight contribute to vitamin D intake, it is challenging to accurately assessing vitamin D status through routine history taking during office visits. Despite these challenges, familiarity with these updated guidelines is essential for primary care providers to ensure effective care and avoid unnecessary testing supplementation. Yes, absolutely right. And we should take vitamin D. And the sunlight is the main source of about this matter. So we should aware of our health and we should follow the guidelines. Thanks to everyone.